Let's start off with the monoamine oxidase inhibitors. Monoamine oxidase reduce the breakdown of norepinephrine and serotonin in the presynaptic neuron. So you can see there that the MAO inhibitors are acting at the level of the presynaptic neuron to reduce the breakdown of those drugs before they're even released. The increased amounts of norepinephrine and serotonin are then stored in the vesicles. So vesicles is Latin for bag. So they have little bags of hormone at the end of these nerve terminals, and they become ready for use. When the nerve fibers are firing, the increased amount of transmitter is then released into the synaptic cleft, and so you have more postsynaptic stimulation. That's how MAOs work. Monoamine oxidase inhibitors can be selective and non-selective. The non-selective monoamine oxidase inhibitors include a large list of drugs, including phenelazine and tranylcyclopromine. These are the two that I want you to remember. You don't have to remember, obviously, the 21 others for your exams. The more selective MAOA inhibitors include Manarix or moclobemide. Now, this is a prototypical drug. This is the one that you'll probably be tested on. The selective MAOB inhibitor is selegiline, and it is also used in Parkinson's disease. This is a prototypical drug. There are many, many MAOA-B inhibitors that are selective, and you don't need to know them all. Side effects to MAOAs and MAOBs are usually due to increased norepinephrine in the nerve terminals. So this means peripheral autonomic sympathomimetic effects that we covered before in our autonomic nervous system lectures. It may actually lower blood pressure, and it may reduce the seizure threshold, which means that you have an increased risk of seizures with MAOs. Why is it that MAOs can cause a reduction in blood pressure? Well, you have to remember that MAOs are being given in the absence of indirect sympathomimetics, and that's how they cause a drop in blood pressure. So it's not just about sympathomimetic activity, it's about which type of sympathomimetic activity you're engendering. Now, in the presence of an indirect sympathomimetic, MAOs cause a large rise in blood pressure. MAOs, in fact, may cause severe hypertension in patients taking tyramine. So tyramine is a precursor to adrenaline, and it is metabolized by monoamine oxidase. Now, tyramine is found in aged cheeses, in soybean, in beers, and in red wine. And it's also found in cured and processed meats. So a meal like this to a patient who's taking a monoamine oxidase inhibitor can be quite deadly because it can cause severe hypertension. This is the great drawback of MAOs.